In this course, we will present the basic principles of electrosurgery. It is the first in a series of courses on electrosurgery. In the first 3 courses, the basic principles, clinical effects, and laparoscopic application of electrosurgery will be discussed. After this, it is recommended to follow the courses on specific electrosurgical units and specializations which may apply to you. Today, electrosurgery is used in approximately 80% of all surgical procedures, as it is an effective tool for cutting and coagulation. These effects are achieved by heat generated due to a controlled amount of electricity flowing through tissue. Still, there are a lot of hazards that may occur when using it, and every year many patients and healthcare practitioners are injured needlessly by electrosurgical equipment. These injuries are almost always caused by user error and a general lack of understanding, and not equipment failure. By understanding the functioning of the specific generator, the best surgical effect can be obtained, and side effects can be avoided. Electrosurgery is a complex technology that is often not well understood by clinicians. This course aims to change this. The term surgical diathermy is an alternative name for electrosurgery. Before the advent of electrosurgery, cautery referred to the practice of applying a hot implement to a bleeding wound to cause hemostasis. This form of cautery is still in use as a handheld pencil made of resistant metal wire through which current is passed to generate heat. The pencil can then be applied to the patient. Even though this technique is capable of producing similar cautery effect, it is fundamentally different in that current does not pass through the tissue and there is hardly any control in the amount of heat and its distribution.
The basics of electricity require discussion first. A basic electrical circuit can best be compared to a water circuit. To create flow in a water circuit, some form of pressure difference is required to push the water around. This can, for example, be achieved via a pump. As a result of this pressure difference, water will flow at a certain speed through the circuit. In an electrical circuit, this pressure difference is called the voltage and is expressed in volt and can be provided by a voltage source, such as a battery. Instead of a flow of water, the result is a flow of electrons, called current, expressed in ampere. Whether the water will flow around depends on the pump's ability to create a pressure difference and the resistance within the circuit. For example, narrowing a part of the water's tube results in resistance, limiting the water's ability to flow. With electrical resistance, expressed in ohm, the electrical energy is transformed to different forms of energy, such as heat or light. An example of such an electrical resistor is the luminous part of a light bulb. In a water circuit, increasing the pressure difference results in a faster flow of water. In contrast, increasing the resistance results in a slower flow of water. In an electrical circuit, the same principle holds. Increasing the voltage will result in a higher current, whilst increasing the resistance will result in a lower current. These terms are related to each other by Ohm's law, which states that current is equal to the voltage divided by resistance. Alternatively, this formula can be written as voltage being equal to the current multiplied by the resistance. The power delivered to a system by a source is equal to the voltage multiplied by the current. This is expressed in watt, representing the amount of energy per time unit. The same electrical circuit can be used to explain electrosurgery. In this, the voltage source is the electrosurgical unit, the electrical switch is a foot or hand switch, and the main resistor is the patient's body. The result of the tissue being exposed to electricity is an increase in temperature depending on the amount of power, resistance of the specific tissue, and duration of the exposure. The amount of power provided by the system can be controlled via the electrosurgical unit. This can be done by setting the maximum power in watt that may be delivered by the system. Note here that this controls the maximum power that may be delivered by the system, and that the system will aim to deliver, and not the actual power being delivered. In addition, the power required for a certain effect varies between different tissues due to differences in electrical resistance. It is also influenced by the type of electrodes and electrosurgical unit used. There are different methods for controlling the output of the generators in electrosurgical units. In these automatic control methods, changes are constantly made to the voltage and current depending on the measured electrical resistance of the patient's body and maximum power settings of the device. Voltage and power control generators are common. In a voltage control generator, the voltage is kept constant. As described in Ohm's law, the current and power thus decrease as the resistance increases. To prevent the power from exceeding the maximum power settings with a low resistance, the current may be limited. As the voltage is constant, the same tissue effect can be obtained for different levels of resistance in the tissue. This is shown here for slight contact with the tissue, resulting in high electrical resistance, and complete contact with the tissue, resulting in low electrical resistance. In a power control generator, both the voltage and current are adapted to maintain a constant power. As again described in Ohm's law, the ratio between voltage and current changes depending on the resistance. As a result, the voltage is increased as the resistance increases. Thus, the tissue effect can change depending on the electrical resistance in the tissue. This is shown here, again for both a high electrical resistance and low electrical resistance. If the voltage drops below 200 volt due to the low resistance, a cutting effect can no longer be obtained and coagulation will occur, resulting in hemostasis. The control method used by a generator may vary between different electrosurgical units and among the available modes of a specific unit. Electrosurgery makes use of alternating current. This means that the current is constantly changing its direction. As a result, there is no actual flow of electrons, but rather an oscillation. Using direct current would result in a flow of electrons and cause electrolysis. The alternating current used in electrosurgery does not shock the patient due to its frequency. At low frequencies, alternating current can interfere with the functions of the cell and result in neuromuscular stimulation or a shock. To prevent this, electrosurgery uses a higher frequency. The voltage waveform used in electrosurgery has a large influence on the resulting tissue effect. There are two main waveform modes being used: cut and coagulation. A cut waveform has a continuous, relatively low voltage waveform. It is capable of rapidly warming the tissue using sparks, which can only form when the voltage is above 200 volt. This results in the vaporization of the intracellular fluid and rupture of the cell. In contrast, a coagulation waveform has a relatively high peak voltage waveform that is only activated for about 6% of the time. As a result, the surrounding tissue is heated with intermittent spikes and cools down in between, resulting in cell dehydration. This results in the cell forming a coagulum by the clotting of proteins and can be achieved with little, if any, scarring. The effect of these waveforms on the tissue is clear. With a cut waveform, little charring occurs and a clean cut can be created. In contrast, the same conditions with a coagulation waveform result in maximum hemostasis. It is also capable of cutting tissue as the voltage is above 200 volt, but is less suitable for this application. Aside from this, a large number of alternative waveforms can be created to suit different intended tissue effects. Common are so-called blend modes, in which the activation time and voltage of a waveform is adapted to create a certain combination of cutting and coagulating. In addition, several specific waveform modes may be available to suit a specific tissue effect. On the electrosurgical unit, the controls for the cut and coagulation waveform modes are clearly distinguished by color coding. The cut mode is always yellow, whilst the coagulation mode is always blue. Alternative modes can often be found within one of the two modes, depending on which mode it resembles most. Here, an overview of the cut and coagulation waveform modes can be seen. There are two types of electrosurgery: bipolar and monopolar. In bipolar electrosurgery, two active electrodes of different polarity connecting the tissue to the electrical circuit are part of a handheld device. This is directly connected to the electrosurgical unit, and no additional electrodes are required. To clarify and simplify the animations, direct current is shown instead of the actual alternating current. Due to the placement of the electrodes, only the tissue grasped between the two electrodes becomes a part of the electrical circuit and will be affected. When using electrosurgery in egg white, only the material exposed to current will heat and harden. Thus, it can clearly be seen that with bipolar electrosurgery, only the egg white between the electrodes is exposed to large amounts of current and hardens. As no unintended tissues are exposed to current, the method is relatively safe, yet it is less suitable for cutting applications and can only be used on tissue that can be grasped. To use bipolar electrosurgery, a small gap is required between the two electrodes, as current will otherwise not pass through any tissue. The device can be controlled by a foot switch, or sometimes using an automatic start-stop mechanism. In this, the device is automatically activated when contact with the body is detected through its resistance, and deactivated when a coagulum is formed. A more commonly used technique is monopolar electrosurgery. Here, only one of the electrodes is handheld, being the active electrode. The other electrode is to be placed on a well-vascularized area of the body in the form of a relatively large dispersive plate. Both electrodes are directly connected to the electrosurgical unit to complete the electrical circuit. The dispersive plate, or electrode, is often incorrectly called a ground pad or neutral electrode. This is incorrect, as the same amount of current is going through the active electrode and dispersive plate when correctly used. The device can be activated either by a foot or hand switch. The reason why only the tissue near the active electrode is affected is that the contact area of the dispersive plate is more than 10,000 times larger than that of the active electrode. The amount of current remains constant between the active electrode and dispersive plate. Still, the area over which this current is distributed is increased by a factor of over 10,000. As a result, the so-called current density is over 10,000 times smaller at the dispersive plate as compared to the active electrode. As a result, the heat created will be highly concentrated at the active electrode and highly distributed at the dispersive plate. When using monopolar electrosurgery in egg white, it can clearly be seen that current quickly disperses from the active electrode towards the dispersive plate. Here, only the egg white near the active electrode is heated and hardened due to the relatively large current density. This can also be compared to a long tube that starts very narrow, but quickly becomes very wide. Water will flow very fast in the narrow area, but rapidly slow down as the tube becomes wider. Monopolar electrosurgery should only be used when the electrical pathway to the dispersive plate does not contain another point where a large current density may occur, as this will result in similar heating at this second high current density point. Logically, increasing the contact area of the electrode tip reduces the current density in this tissue at the point of contact, making it more suitable for coagulation purposes. Decreasing the contact area increases the current density, making it more suitable for cutting purposes. There are different tissue effects that can be achieved using electrosurgery. Electrosurgical cutting, also known as electrosection, is performed with a cut or blended waveform, dividing tissue via electric sparks that provide intense heat at the surgical site due to its high current density. To induce this, the active electrode is held just lightly against the tissue. At the appropriate power settings, the active electrode will easily pass through the tissue without drag or excessive visible sparking. The main advantage of electrosection over scalpel surgery is the ability to achieve simultaneous hemostasis for smaller blood vessels by using a blended waveform. Another tissue effect is fulguration, also known as spraying or non-contact coagulation. Here, a specific fulguration or spray waveform is used with the active electrode being held slightly away from the tissue. The high voltages of these waveforms result in sparks to the areas of the tissue surface with the lowest electrical resistance. As a result, there is less heating of deeper tissue and a wide, superficial coagulum is formed. This can be compared to preparing steak. To get a rare steak, it should only be placed briefly on a very hot grill, causing superficial heating and grilling. Another method of achieving hemostasis is the tissue effect of desiccation, also known as direct contact coagulation or pinpoint. In this, a coagulation waveform is used whilst the active electrode is in direct contact with the tissue. This results in less heat being gradually delivered and causes a deep coagulum to form over a longer duration. This can also be compared to grilling a well-done steak, where the steak is slowly heated over a longer duration. Whilst desiccation of tissue can be performed using both monopolar and bipolar electrosurgery, the sealing of blood vessels can best be performed using bipolar electrosurgery. To simplify this commonly performed action, advanced bipolar devices have been developed. These devices quickly provide a controlled combination of power and pressure, using continuous resistance measurements to ensure a good seal. When a complete seal is detected, the device will automatically deactivate. Note that it is possible to cut using the coagulation waveform as long as the voltage is over 200 volt. It is also possible for power-controlled generators to coagulate using the cut waveform, having the advantage that a lower voltage is used to coagulate, making it more suitable for minimally invasive procedures. Yet, this might require adjustments to the size of the active electrode tip or to the maximum power settings. During this course, the basics of electricity, the differences between a cut and coagulation waveform, and the principles of monopolar and bipolar electrosurgery have been discussed. the tissue effects of electrosurgical cutting, fulguration, desiccation, and vessel sealing have also been discussed. To obtain a better understanding of electrosurgery and the considerations during usage, it is recommended to now do the follow-up course on the clinical effects of electrosurgery.